I feel that the stethoscope is going to end up in the Museum of Medical Antiquities in the near future, and physicians will be using ultrasound technology to not merely listen to the heart and not merely listen to the abdomen and the lungs, but with the ultrasound we actually can look inside the body and get early detection of disease to a far greater degree to see things better than we could before. In addition, there's other forms of cancer screening that's much more comfortable. Not enough people undergo screening colonoscopies. They don't like the idea of this 5-foot-long tube put inside of the colon to look at it. Yet we can now do a virtual colonography for early detection of colon cancer, which is very helpful and much more comfortable for the patient. We also have a swallowed camera. Scientists have developed a small camera that's the size of a pill camera. You swallow this pill, it passes through the entire gastrointestinal tract, and it sends out photographs as it passes through so that the radiologist can look at that afterwards and see if there's any disease in there, and that's far more comfortable than the colonoscopy as well. We know that early detection works, but unfortunately we're only doing it in conventional medicine for 4 types of cancers. We do it with colonoscopy for colon cancer, with mammography for breast cancer, with Paps and pelvics for cervical cancer, and with digital rectal exams and PSA testing for prostate cancer. But when we do it, if we're able to diagnose these types of cancers when they're stage 1, when they're encapsulated, when they're small, they haven't spread throughout the body, cure rates are very high. Yet, if we're not able to detect them until they've spread, they've metastasized far away from their original site, the death rate is much greater. The survival is much smaller. We do know that early detection leads to increased survival. So with prostate cancer, the percentage of cancers diagnosed before they have spread is high, and as a result, 5-year survival rates are high. Breast cancer, it's a little bit lower. Lung cancer, it's lower yet. But we know that early detection does save lives, and we can do more than do early detection for just those 4 cancers. We can do early detection through the use of total body ultrasound for many of the over 200 types of cancer that there are. Action step, use the latest cutting-edge technology to determine if you have any evidence of early heart disease or cancer years before symptoms occur so that you can take aggressive preventive action. How about looking at our genes? I think that doing genomics testing can help us as well to stratify our risk. One example is what's referred to as the ApoE gene. The ApoE gene can affect what our risk is of Alzheimer's disease. The ApoE gene comes in 3 varieties: ApoE3, ApoE2, and ApoE4. We get 2 copies of the gene, one from our mother and one from our father. Over 60% of the population has 2 copies of ApoE3, which is average risk of Alzheimer's, which turns out to be about 9% risk at the age of 85. If you're fortunate enough to have inherited 1 copy or 2 copies of the ApoE2 gene, E2 is very protective against Alzheimer's. Yet only 1% of people or less than 1%, about 0.5% of the population has 2 copies of E2. They're virtually immune from Alzheimer's disease. And about 10% of the population has 1 copy of ApoE2, and they're at much reduced risk. However, 25% of the population has 1 copy at least of ApoE4. If you have 1 copy of ApoE4, your risk of Alzheimer's disease triples. So if you do this testing and you discover that you have 1 copy or in the 25% that has a copy of ApoE4, you want to take aggressive action to do what you can do to prevent Alzheimer's disease. And there are a number of dietary strategies and supplementation strategies that can be done to help it now. Women can do testing for the BRCA, the breast cancer gene. This is a family where daughter, mother, the mother of that daughter, and the grandmother all have been diagnosed with BRCA, and 3 of the 4 have already been diagnosed with breast cancer. So by doing the BRCA gene testing, you know if you're at high risk of getting breast cancer, and you can take steps to avoid developing that. Unfortunately, the only step that can be taken is prophylactic mastectomies, but granted, it's not a perfect solution, but these women are at more than 90% risk of developing breast cancer, so it's something that they want to know about and take care of. So genomics testing can be a benefit. We'd mentioned the telomeres, the little end caps at the end of our chromosomes. This is a testing that you can do. This is an individual who was in his 40s, did telomere testing. He actually found out he had longer than average telomeres. He had telomeres of someone about 25 years of age. So this individual was doing very nicely. But how about if his telomere length was here and he had telomere length more like someone who was 65? Then he'd want to take steps to try to lengthen his telomeres. And as I mentioned, there is now a new supplement called TA65 that you can take that's been shown to increase the length of the telomeres. We know that increased telomere length is associated with a more youthful appearance, a longer life, decreased risk of many of the diseases of aging, and also people that take the TA65 have been found to have more energy, focus, sex drive, and athletic ability. So there are things that you can do to measure your telomere length and to do something about it if they're short. In addition, we had talked earlier about how teenagers have high hormone levels, 5-year-olds have shorter hormone levels, which often confers this growing older without aging for teenagers. And we can do this later in life, so it's important to check your hormone levels because this is part of the game plan for how the aging process destroys our health. Our hormone levels go down. This is a woman who came in for hormone replacement therapy. She had noticed that she had gained some weight around the midsection. She had developed some skin sagging, loss of body hair, things along those lines. She decided she wanted to do something about that to age more gracefully. So she went on hormone replacement therapy, and after 4 months, this is what she looked like. Well, honestly, this is her husband. So this wife and husband measured their hormone levels and then engaged in hormone replacement therapy. And 4 months later, this is what they look like. So with the combination of good diet, exercise program, and hormone replacement, in just a few months, they were able to become much more youthful. This was a patient of mine, Linda, who the average age of menopause is age 50. She wasn't sleeping well. She was experiencing hot flashes. She was crying for no reason. She was quite unhappy. She engaged in hormone replacement therapy, estrogen and progesterone. These were the bioidentical forms of hormones. And after a mere 3 or 4 months, this is what she looked like. So she was much happier. She looked more youthful. She, in fact, looked like she'd had a facelift. But she didn't. All she did was took the hormones. So the hormones can be part of our anti-aging strategies as well. There's a lot of talk today about stem cells. And you might say that you're only as old as your stem cells. The stem cells in the body are the cells that repair tissues that get injured. So if, for instance, we have an injury, we get a scrape, there's an initial inflammation phase, then the stem cells come in, they regenerate, and then there's a little bit of fibrosis, which is scar tissue. But in an infant, the regenerative phase is the greatest, and this is because the stem cells are quite youthful. So an infant will get a scrape or a cut, and they'll leave almost no scar. As we get older, the inflammatory stage is much bigger after an injury. The stem cells are older, there's not nearly as much regeneration, and we heal by forming scars, fibrosis tissue. So we really only are as old as our stem cells. So one of the things that we can do that's recently become available is we can essentially save our stem cells right now and then freeze those stem cells and essentially freeze ourselves in time. We are now offering in our clinic a simple procedure where we remove a couple ounces of fat from the belly, isolate the stem cells, put them in frozen storage, and then they're available for your future use should you need them. So you'll freeze yourself in time and you'll have stem cells that are no older than they are at the time that we freeze them. So this is another method of anti-aging that's cutting edge. One of the tests I think that makes sense is measuring your biological age. The biological age is the age that your body seems to be as opposed to the age that your body actually is.